Thank you, Phil. Um, and thank you, everyone. I want to thank the Boots on the Ground committee to putting this together. I'm always amazed at the opportunities that I get to share my experience, strength, and hope. I know that I'm in the presence of a lot of smart people, you know what I mean, who have experience as well. So my intent is not to preach or to lecture. I do have some slides that have some data, but I mostly use my experience as well, my lived experience. I'm a person in long-term recovery. And what that means to me is that it's been over 20 years since I've had any problems with drugs or other alcohols. And because of that, man, I get to live this amazing life. But I also have over 20 years of active using. And so combined 40 years of experience, of lived experience. Right. And so I'm gonna share my screen. Give me 1 second. All right, let me get started. Okay, thank you for your patience. Thank you again. I'm always amazed at the opportunities to present, and I get nervous. You know what I'm saying? It's intimidating to be in the presence of excellence. You know what I'm saying? And so just know that my fumbling is coming from that, but I appreciate the nervousness because it lets me know, it reminds me of how important it is and the opportunities that I get to get, that I have, right? So my presentation today is on the needs of recovery community organizations and the overview of the opioid epidemic in the Black community, right? And so again, my name is Tony Sanchez. I am the Director of Partnerships here at Faces and Voices of Recovery. But most importantly for me is that I'm a person in long-term recovery. And because of the gift that I've been given, I get to live this amazing, amazing life. Yesterday was my grandson's 12th birthday, and we balled. You know what I'm saying? Like, we hung out and we had a really, really good time. And one of the cool things I could say about that is that because of recovery, my grandson has never seen me under the influence, and I can actually be present, right? And so I want to talk a little bit about what a recovery community organization is, right? And so a recovery community organization is our independent nonprofit and that are led and run by representatives of local communities of recovery on behalf of the recovery community. You know, and independent meaning standalone. However, some RCOs, right, are hosted under the umbrella of a nonprofit fiscal agent, right? And in these cases, these RCOs must have its own autonomous governing body and advisory board where decisions regarding policies, advocacy, staffing, budget, finances, and programs are made. I mean, anything that takes to run, because it is a business, right? With a specific intent. Recovery community organizations are usually created by people in personal or family recovery in response to an unmet need in their community. And I think, and that's really, really important to point out, right? It's because, typically, our behavioral health system has been created or is driven by crisis, right? And what RCOs do, it alleviates that tension, right? It creates an opportunity so that people can seek help before they get into crisis, or maintain or sustain their wellness by having a safe place to be able to connect to. So the values and principles, very briefly, authenticity of recovery experiences and voice. So really, like, RCOs, for me, like, the primary purpose, or one of the things that they do, is that developing leaders, right? Offering opportunities for people in recovery, family members, and I'm talking about everybody, family members, friends, and allies, to express their collective voice and learn new skills and responsibilities, and provide a forum for community service. You know what I mean? One of the things that, that I believe is that, recovery can be initiated in any environment, and it's usually initiated in artificial environments like detoxes, treatment centers, and stuff like that. But it's really maintained and sustained in the community of that individual's choice. And what RCOs do is that they help prepare the community to support those individuals coming in, right? One of the things that was really important for me in my own recovery is to be able to have a space where I could bring all of who I am into that space, and as a person of color, that hasn't always been true, even in the recovery setting, right? So, RCOs routinely engage people in recovery, their families, and other stakeholders in a participatory process, a program, decision-making, and conducting activities. But they must be done, right? In order to be effective, they must be done in a way that are culturally aware, or culturally, that are diverse and meet the needs of individuals on a cultural level. Does that make sense? Everything happens within a cultural context, and in order for, the presenter before me talked about not using cookie cutter approaches. So in order for us to be effective in community support services, we have to be very cognizant of the fact that they need to be culturally competent. And this is information that I think everybody on this Zoom platform knows, right? That there's significant differences in the rates of access, diagnosis, and treatment for the Black community. Either we're at times, we're overdiagnosed, and a lot of times, underdiagnosed. So that, and I don't really like using the word diagnosis. I'm not a doctor. I'm not a clinician. But either we're overprescribed or underprescribed, services or availability to services, right? It's more likely to receive the Black community are more likely to receive treatment for mental health in emergency rooms and hospital settings. And there's a number of, reasons why that is, and COVID, exposed a lot of that, the intersectionality of systemic racism and not only behavioral health, but all types of health. Right. And for a lot of, I remember when I was my primary care physician was the emergency department. I was unemployed, I was unemployable, or it was the prison system, because I've spent time in prison, not only in New York, but in the state of Georgia as well. Right? And that second bullet point, right? One of the things that it doesn't mention is that when individuals are maybe having a behavioral health challenge or considered to be in crisis, and someone dials 911, it's usually not an ambulance that's going to show up. It's usually going to be a police officer. You know what I'm saying? And we already know, and this is not an opportunity to bash, law enforcement. This is not what I'm talking about, but we already know what can happen when there's interaction between law enforcement and the Black community. You know what I'm saying? That sometimes they don't even make it to the mental, to the emergency room or any other hospital settings. And we also know that historical racial exclusions in health, education, and social and economic context. Again, COVID, these are things that we've been blatantly aware of, but what COVID has done was really brought those things to the forefront, that we can't deny that. You know what I'm saying? And one of the things that I truly believe is that, we, as a person in recovery and as a Black man in America, I can't really wait for the government to save me or my community. You know what I'm saying? That there's an inherent responsibility that I have, now that I've been given this gift, to share it with others and let people know, especially people who look like me, that recovery is not only possible, but that recovery is real, and that recovery should always be the expectation. And why is this important, right? Because in studies show that most people in the Black community will receive no treatment during their lifetime. You know what I'm saying? That although there's we've made tremendous progress through funding, and it's sad, right? That but true that it had to be a certain demographic that had to be impacted by this opioid epidemic for national change, the way that we talk about substance use disorder, the way that the funding and the supports that are available, you know what I mean, have increased because a certain demographic has been touched by it. However, you know what I'm saying, what we do know is that even with the increase of resources, they are not being distributed in an equitable fashion, and the Black community is still being denied access, you know what I'm saying, at a slower rate or a lower rate. So what do we know from research, right? And if there's any researchers here, like, I'm not trying to be disrespectful to your craft. So there's less attention on the needs of the Black community in the opioid epidemic compared to white communities. I just touched on that, you know what I'm saying? You know, I was on a call a couple of months ago, and it was a national call, and you know, and it was and again, this is not to bash law enforcement, right? But this police officer, you know, he talked about how you know, he patrolled an urban community. I don't remember what state it was, and that they carry, and that they are mandated to carry Narcan, right? But that the Narcan is not for the people, it's for the dogs. You know what I'm saying? Like that if one of their drug sniffing dogs you know, get sick by, you know what I mean, finding a batch of fentanyl or something like that, that the Narcan was there for the animal, but it was, and I don't think, but they weren't distributed to the community for the actual people who were dying. So it's still, what it told me is that it's still looked at as a moral deficiency. It still looked like as a, you know what I mean, like we're doing it to ourselves, you know what I'm saying? And there's still, but the solution is that or the hope that there's still opportunities for education and training and collaboration, so that people can, you know, so we can change the mindsets, you know what I'm saying? That this is going to take all of us, right? You know, due to biases, Black African Americans are significantly less likely to be prescribed opiate prescriptions for pain than white Americans. You know, and this one touches me personally, right? My wife passed away 2 years ago, and at the end, she was extremely ill. And there was a lot of times that there was a lot of hospital visits, and she had open heart surgery. She broke both her hips. She had a kidney pancreas transplant. And a lot of times the doctors wouldn't want to give her, pain medication. I'm like, yo, dude, give her the medication. You know what I'm saying? Like, and that's an isolated, or I don't know if this, I don't think it's isolated. That's my personal experience, but it's really harmful when someone who actually needs the medication, or being denied pain medications because of biases, that contribute to their quality of life, right? Stigma contributes to the lack of treatment and recovery support services. I think Anita touched on it. Stigma is one of the main reasons, not the way that that people don't get services, not just externally, but the internalized stigma. What I started to believe, the messages were so powerful in the 80s and 90s, right? That I started to believe that I wasn't worthy, that I was probably better off dead. You know what I'm saying? Or that it was a moral deficiency, that there was something wrong with me, and I couldn't understand why I would continue to choose to use drugs instead of, going to work or making it to my parole officer, knowing that if I missed another appointment that I was gonna be incarcerated. But it wasn't until I got more information, especially trainings like the Science of Addiction and Recovery, that it allowed me to understand what was happening to me in my brain, and why I was making what seemed unreasonable or unexplainable to me, but also it gave me the hope that I could heal and I could recover. Mistrust in health and social justice systems causes the Black community to avoid seeking treatment. When has the system been favorable to the Black community? You know what I'm saying? And, we talk about, there's been a lot about follow the science, and science is really, really important. I know that in the name of science, you know what I'm saying, we got Tuskegee. I know that in the name of science, they had radiation treatments in Puerto Rico, where my family's from. In the name of science, a lot of atrocities have been done to the Black community, or even in law enforcement. Growing up in New York City in the Bronx, when law enforcement came into my community, it wasn't to protect and serve. You know what I'm saying? It felt more like an occupation. It felt more like an infiltration. It felt more like a it felt scary. Lack of understanding of the science of OUDs and other SUDs result in misperceptions of SUDs. You know what I mean? And what I have to say about that is that, not being culturally aware, not using cookie cutter approaches, you know what I mean? Just don't work, and a lot of times cause more harm than good. So 5 strategies to that SAMHSA has identified, to address the opioid misuse, right, is a holistic approach, right? You know what I mean? Like making sure that the whole person is, but not the whole person is being looked at, right? Not just a specific acute illness, but everything, you know what I mean? Or everything that encompasses that human being. Community involvement. One of the things that I believe is that recovery is deeply personal, but creating recovery opportunities is everyone's responsibility. I talked about culturally relevant campaigns, or being culturally relevant, you know what I'm saying? Making sure that we are inclusive to the needs and the cultural needs of individuals and communities as a whole. You know what I mean? Culturally specific engagement strategies. And that also includes, when going back to recovery community organizations, right? That the makeup of the RCO really is a representation of the community that they serve. You know what I'm saying? So, like, you know what I mean? If you have a community that's that's diverse, you know what I mean? Are the team members diverse? You know what I'm saying? But if I went to seeking services, would I only see individuals that didn't look like me? And that's really, really important. Create a cultural relevant and diverse workforce. I just touched on that. I mean, again, not just that includes language and just being aware of cultural norms so that we can actually meet individuals where they are. So what can RCOs do, right? They can perform a language audit of existing materials for language that may be stigmatizing, then replaced with more inclusive language, right? Using the search and replace function for electronic documents, for example, is a great way. You can look at documents and type in the word addict and then replace it with person or individual. Search and replace functions for other policies as well. So review internal and external documents, right? And watch for first person language, right? Person with substance use disorder versus addict. Using language with clear and easily understood meanings, like, instead of negative urine drugs, like negative urine drug screens versus clean or dirty, right? And then not using fear-based words like unlike anything we've seen before, you know what I mean? Like Matt, like just categorizing the situation in a catastrophic way, right? And then use existing resources for language assistance. Faces and Voices is a great place that you can go to, and there's other places like SAMHSA and other resources that are readily available that we can use that are readily available at our fingertips. So recommendations for moving forward, right? Clarify, each individual's desires, recovery goals, and adjust services to meet those goals, like, and tailor services to each individual's direct, short, and long-term outcomes and needs, right? So again, not a cookie cutter approach, but a more personal recovery plan, right? And that the plan is included with the individual who is seeking, who's going through it. And the reason why that is important is that people are more likely to participate in things that they are a part of creating, right? So, you know what I'm saying? If I give, you know, I remember working at an organization where we would do, like we would create treatment plans to individuals, but not really taking into consideration the person's hopes, dreams, aspirations, goals, you know what I'm saying? Because those are the things that we really need to touch on so that there's not, and I'm not gonna say compliance, because that's not, but participation, right? Buy-in, right? Again, culturally effective whole person approaches, and multiple pathways, right? That, you know what I mean? As a person in recovery, I'm a 12-stepper, you know what I mean? 12-step, yeah, that has been my pathway. That I'm true and blue to my pathway. But what I know is that what worked for me doesn't work for everybody the same way. So actually meeting individuals where they at and helping support, you know, walking alongside individuals and their families so that they can sometimes help them identify what that pathway is, what works, what doesn't work, and how do we continue to move forward together, and doing with, not necessarily for. Self-directed full continuum of health and social support. I address addressing core current conditions and trauma. I mean, the approach should be trauma informed, right? I mean, and everything that we do. And also, we should also address not just substance use disorders, but also the mental health. I don't know anybody or too many people who don't live, you know, who don't live with both challenges. It may be undiagnosed or untreated, but creating a space where an individual can bring all of who they are and get help for what they need is paramount, right? And then provide 24/7 not just crisis support, but recovery support. You know what I mean? And one thing that I know is that the streets, they recruit 24/7. Right? You know, drugs are available 24/7. You know what I mean? Like, I know that from personal experience. You know what I'm saying? So we need to be able to meet that energy or surpass that energy, you know what I'm saying, with a level of intensity that's fierce, you know what I mean? Because lives depend on it. And we need to think outside the box and come out of that 9-to-5 mentality and really create opportunities so that at 2 a.m, you know what I mean, there's a place to go or someone to talk to. You know what I'm saying? Because those are the times I remember for me in my own personal experience that I wanted help the most, you know what I'm saying? But at 9 o'clock, you know what I mean, I was back off to the races, sometimes a little sooner. So this is from the President's Commission on Combating Drug Addiction on the Opioid Crisis in 2017, right? That RCOs are innovators and collaborators working with hospitals, treatment providers, law enforcement, courts, corrections, child welfare systems, and broader communities to reduce drug use and helping people achieve and sustain recovery. Their flexibility allows them to rapidly adapt to changing circumstances and to identify and fill gaps in systems and services. You know what I'm saying? And so I say that, right, that we need to be able to do that in our own communities as well. And that it takes all of us. It's not a us versus them, that in a recovery-oriented system of care, it takes all of us, right? You know what I'm saying? And everyone needs to work together in order to create those opportunities within our community so people can have the best chance to live their best lives. And with that, right, because we don't know which door an individual is going to come in, right? For me, I found recovery in the Clark County Jail here in Athens, Georgia. You know what I'm saying? That's where recovery was introduced to me, and that's where my recovery journey started, right? You know what I'm saying? But then it was maintained and sustained in the community of my choice because there was adequate supports, people who understood, there were mentors, and there were people who looked like me, you know what I'm saying, that I can emulate, because then I knew that recovery was possible for me as well. Thank you so much.